Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Health Care. We're talking about cervical cancer, which is the fourth most common cause of death among women with cancer. But with proper awareness and screening, it is preventable.
Cervical cancer is a disease of the cervix, which is the opening of the uterus, and it is in the end of the vagina. Cervical cancer symptoms include heavy periods, bleeding between periods, bleeding after intercourse. In a woman who has gone through menopause, it may also present as bleeding where periods had stopped prior to that.
What is HPV and its relation to cervical cancer?
The problem with the HPV virus is that it can infect cells in the cervix, vagina, vulva, mouth, throat, anus, and it can stay in those cells and change them.
How important is the HPV vaccine in preventing cervical cancer?
Cervical cancer is the only cancer that we can prevent with a vaccine. And the vaccine is best given at a young age.
What is a Pap test?
A Pap test is performed by looking into the vagina with an instrument called a speculum, which allows us to see the cervix. When we look at the cervix, we pass a small brush into it to obtain some cells, as well as a spatula to obtain cells on the outside.
How often should women be screened?
Someone who has low risks can be screened with less frequent Paps. Every 3 years if we're just looking at the cells, and every 5 years if we're looking at the cells and testing for HPV. But women should also let their providers know if anything in their personal history has changed and has put them at higher risk for getting HPV and not being able to get rid of it.